Awesome. Well, good evening, everyone, and welcome to our webinar, Kickstart Your Healthcare Career, Real Stories from Pharmacy Technicians. My name is Danielle Stubbs-Kirkland, and I'm the Director of Student Recruitment and Belonging at the American Association of Colleges of Pharmacy. And I am joined by some wonderful colleagues here from the Pharmacy Technician Certification Board. So real pharmacy technicians will be sharing their paths with you all today. And so the agenda for today is we'll have a quick introduction by Zachary Green, um, who is who actually helps lead national pharmacy technician programs at the Pharmacy Technician Certification Board. And then after that, we'll jump into our panelists introducing themselves, talking about their paths, and into Q&A. So if you have any questions for our panelists throughout this session, please feel free to put them in the chat box, and we will hopefully get to most, if not all, of your questions. But without further ado, I will hand it over to Zach to give us a quick introduction into PTCB.
Excellent. Thanks, Danielle, and welcome everybody. So I'm Zachary Green. I'm the Director of Professional Affairs and the Director of PTech, which is the Pharmacy Technician Educators Council at PTCB. What that entails is really working with educators and employers all around the country who advocate for their pharmacy technicians to be certified through PTCB. So many thanks first to our panelists and also AACP for hosting this webinar to explore all pharmacy careers. It's an exciting time to be working in pharmacy because I think we're all looking at it as one entire profession and getting everybody interested in it. And I'm excited that you'll get to hear three different paths for pharmacy technicians to advanced certified pharmacy technicians to even PharmD. So um, with that, I'll just turn it back over to you, Danielle, or whoever you want to take first for their introductions.
Yeah, absolutely. Thank you so much. Yeah, so I will just have you all kind of introduce yourselves, talk a little bit about who you are, where you work, and kind of give a brief kind of journey of your career. So why don't we start with Tiffany?
Hello, everyone. My name is Tiffany Koffroth. I am currently in Houston, Texas. However, I grew up in Reading, Pennsylvania. I started my career as a pharmacy technician at 16 in a Rite Aid pharmacy, and I'm currently working as an advanced pharmacy technician at the University of Texas MD Anderson Cancer Center in continuing pharmacy education. And a little bit about that is I teach a course on sterile compounding, both initial and biannual training, as well as staff whenever I'm needed.
Courtney.
Hello, everyone. My name is Courtney Wiggins. I am a PharmD candidate at Temple University here in Philadelphia, Pennsylvania. I am from North Carolina originally, and that's where I got my start as a pharmacy technician in retail. And then I went on to work in a compounding pharmacy. I also worked for PTCB as well. And I went on into public health consulting. And while I've been in pharmacy school, I have worked in specialty pharmacy. And I currently work for the Hospital of the University of Pennsylvania as a pharmacy intern.
Hi, everybody. Thanks for everybody for being here. I'm Steven Trevino. I'm based out of Oklahoma City, Oklahoma. Pharmacy technician started in 2006 in Houston, Texas, at Sam's Club. So it was a retail chain. And then moved to Oklahoma City in 2011. Noticed that there was a little bit of patient care differences from what I wanted to provide patients versus what we could at Sam's Club. So we decided to open up our own pharmacy in 2013. And now we own seven independent chains in four different states. So kind of seen a bunch of different things as far as the day-to-day as technicians and the operations. Currently, I'm the director of operations and human resources for our chains. But I still staff the bench as needed as well. So yeah.
Great. Well, let's just jump into some questions. So we have some questions that Registrants were able to submit ahead of time. And again, I'll just remind everyone who's here, feel free to put any questions that come up in the chat, and I'm sure we will be able to get to them. So the first question here is, what does a typical shift or day look like for you? Yeah, let's just start there. What does that look like?
So I'll go ahead and jump in. Mine varies based on how the hospital is doing. My main role is education, so creating either continuing or initial education. But if we get backed up in a pharmacy, specifically sterile compounding or retail based, I might get an SOS call to say, hey, please come help out. So my day really varies based on how the patient experience is in my hospital. But if it's a good day, then I can continue on my educational pathway, whether that's creating an online module or teaching hands-on skills about sterile compounding.
And my day varies as well. It depends on the shift. So, if I'm scheduled to work in the IV room, I'm primarily there throughout my shift, compounding IVs in a sterile environment. And also, if I have the other shift, which pretty much works with the PO meds or topicals, I'm pretty much responsible for delivering those meds to the patient floors.
And then my job also varies day to day. So like I said, my primary goal is to assist everybody in operational. So whether that's staff training, new processes that we're bringing in, new services that we're bringing in, I'll kind of write the SOPs for those and educate everybody on it and how to do it in each state. Also work in the bench. So if there is somebody that is in need, I will definitely go help out. Last year, I was in one of our pharmacies in Washington State for 7 months helping out because they were shorthanded. This week we have a new pharmacy manager that's starting, so I'm training him starting Wednesday. So it's just a day by day, depending on what it is, I can handle it for him. So
There was a second part to this question. So for someone considering pharmacy school, how helpful is the technician experience?
Very helpful. So we actually have a bunch of technicians that actually start in either a retail or hospital setting, and then they go through pharmacy school as far as they can, usually prereqs, and then once they start their first year, they go to school full time, and they usually come back to us as a pharmacist. So that day-to-day experience, sterile compounding, looking at medication orders, delivering medications, interacting with the nurses. That's all very, very important tools to learn, especially as a pharma technician, that will better prepare them as a pharmacist.
I'd like to add on to to Tiffany's sentiments. As a pharmacy student, I felt like, having prior experience, it was a way to demonstrate that this was the career path that I'm committed to, and that I feel like those experiences also helped me throughout pharmacy school as well. And it also helped kind of solidify, what I'm learning. So as I'm learning, I'm also able to apply it while I'm working. But I really cherish those memories prior to pharmacy school, working in a pharmacy.
and I agree with Courtney. We've had students before in their fourth year, final year of pharmacy school, and they do rotations and they realize, you know what, this isn't what I thought it was. And your fourth year, last year of pharmacy school is not the time that you want to figure that out. So having the experience as a pharmacy technician, one helps you understand what all the roles are within the company or within the pharmacy, right? Because they're going to be your right hand. So you want to make sure you understand the stressors that they have, you know how to handle those stressors and take some of it away from them, because they do have their own challenges than a pharmacist does. But again, you want to make sure that it's the career path that you want. You don't want to go to school for 4 years after undergrad and then find out that this just isn't for me. So I think it's definitely useful to have some type of pharmacy technician experience before you jump into pharmacy school.
Okay. And I just got a question in the chat here. Someone asked, how expensive is it to become a pharmacy technician and how long does it take to become one?
I can go ahead and jump in there if you'd like. Um, so every state is different on what they require for pharmacy technicians to do with registering with the board or any kind of training like that. But I would say the first step would be looking into getting certified. So I can speak to that part of it. There are two eligibility pathways to get certified through PTCB. One is having 500 hours of work experience in a pharmacy or completing a training program that is recognized by PTCB. There's a list of about 1,700 of them on the PTCB website, and they can be done online, completely virtual, um, at your own pace. So, if you're doing it while you're in school, you can do that way. The local community colleges have pharmacy technician programs, and even some colleges of pharmacy have pharmacy technician training programs if you are interested. So it's really just up to you how you want to go about achieving that, if you want to go that route to certification. But there are states that do hire technicians that are not certified. So you can register without having certification, or you have to get certified within a certain period of time. And again, there are no two states alike.
And I can kind of chime in about Texas in specific, if anybody's in Texas. So you can get registered with the State Board of Texas as a technician trainee. It's valid for 2 years. And you can work in a retail setting. Usually, hospitals, in my experience, usually do not hire on technician trainees, but retail is a really great place to start to learn about, customer service, insurance, workflows, drive-through, medications, just hearing from your pharmacist talk with their patients. It's a really great experience. And then that also allows you time to take the pathway to study, self-study, and then hopefully sit for a national certification for pharmacy technicians.
Great. And I believe, Stephen, I think your path is really interesting. If you wanted to talk a little bit more about kind of how you got started.
Yeah, I can definitely do that. Before I do that, I'm just going to say Oklahoma is one of those states that doesn't require a national certification. So it is a little bit different. So if you do want to get into pharmacy in Oklahoma, you can without that certification. Again, it's not as easy because you have to become a trainee, like Tiffany was saying, but the pharmacist will give you a questionnaire. It's about 20 questions they submit to the state, and then you become a technician. So it's a lot easier that way. There are other states like Washington right now that you have to be aligned with a training program that the state puts out. So if it's with the pharmacy, the pharmacist manager is usually the director of that training program that you have to complete, and then you can take your test through the PTCB. So like Zach was saying, there are different rules through every state. So just check and see where you're wanting to get hired and see how they want you to do it. Personally, I was working at Sam's Club, like I said, as a front end supervisor. I wasn't interested in pharmacy at the time. The manager was looking for somebody, and they saw the way I worked, and he offered me a position in the pharmacy. I, of course, declined it because I didn't want to work in pharmacy at the time. But he convinced me to do it. I did on-hand training, like Zach said. I just did the working hours. It took me a while to figure it out, right? Pharmacy is completely different than anything else that I've ever done. So there are a lot of things to learn. But once you get a hang of it, it's fairly easy. So I just did on-hand training. I going to be honest, I failed my first test. I didn't realize that the test had a bunch of different questions than just retail pharmacy. So if you are studying for this test, I know that's one of the questions that we were going to bring up, is just make sure you look at all aspects of pharmacy, whether it's hospital pharmacy, retail pharmacy, closed door pharmacy, compounding, math, drip rates. I didn't know anything about pharmacy as far as hospitals, so I failed it because it was heavy on drip rates. I did not know the formula. I just guessed and I failed it. Second time, I definitely passed it. I was well prepared then. But yeah, I didn't go to a technical school. I didn't do any of that. I just did on-hand training and then took my test through Sam's Club. And most employers will pay for that. So if that is something that they're willing to bring you on, they usually will pay for the training and your test fees.
Yeah, and speaking of studying, are there any other study tips that any of you have for studying for the certification? That was also one of the questions that was pre-submitted.
So I'll kind of echo what Steven said, right? There's a lot of subtopics of pharmacy, right? It's not just a retail versus hospital. And neither exam that is accepted nationwide is one or the other. So you do have to study both options when doing a national exam. And there's always going to be math. There's always probably going to be some kind of law. I'd really look at the certification board, and they should provide some kind of blueprint of topics that are included in the exam. And I'd really look at that and then make sure that you feel very confident in those topics. And then if you don't, just either find like an online book that you can, touch up on that, or ask a peer that's in pharmacy, tell me a little bit more about this side of pharmacy, because I'm not sure of that. So reach out to fellow colleagues, ask them questions, or take a look at the resources that are available for the exam.
I'll say what helped me. I completed a pharmacy technician training program during my undergraduate years. And I think what was helpful for me was utilizing like the workbook. So definitely going through practice problems, practicing your calculations, because they're very useful. And also flashcards, so figuring out what learning style you have, what's your best way to study flashcards, knowing like top 200 brand and generic drugs. That's very helpful as well. So I guess a plug for like Quizlet. It's online flashcards. That's really helpful to me. And again, running through practice problems as well.
Something interesting that you all mentioned is, you have to learn different types of settings. So, what kind of settings are available for pharmacy technicians to work in aside from what you might commonly see, like the community or the retail pharmacy?
So I'll go ahead first. Within my hospital environment, it's much more than, hospital versus retail, right? It's specialty pharmacy. It's quality assurance technicians. It's pharmacy resource specialists who only assist patients with insurance problems and making sure that they get the best copay for their medications. We have technicians that are business systems analysts and work with Epic, which is our electronic health record, and making sure the patients are billed correctly. We have technicians that are on the electronic health record and actually help us build medication orders and IV workflow processes for either our retail or our hospital areas. We have a very robust career ladder of 4 rungs that we are very proud of here. But the jobs are endless. And I'm just speaking on behalf of what we have. But taking a look at other institutions and then retail, specialty, long-term care, insurance providers, health insurance. I mean, the list is endless where pharmacy technicians really are working now.
I would agree, Tiffany. Early on, let's say after retail and after compounding, I worked with Zach at PTCB. So that's where we met. And I was a certification program assistant. So like I assisted with processing the PTCB applications, and also the recertification applications as well. And after that, I started working for the American Pharmacists Association. And that was more so of like a, I guess, regulatory pharmacy. So it was a government contract with the Office of Pharmacy Affairs, who provided oversight over the 340B program. And we hired pharmacists and also pharmacy technicians as consultants who specialized in 340B. And it was, I would say they're paid pretty well, I think, as a consultant. So I think that's an option there. I guess my plug would be to, find something that you're really interested in. And especially if it's like a niche area, I think that would be really helpful to you as well.
I agree with y'all. There are so many, and there's still things you could do with pharmacy technicians outside of that. There's closed door pharmacies. There's, Tiffany was saying, there's long-term care pharmacies. You see a lot of these companies making semaglutide or tirzepatide. Those are all coming from 304B pharmacies. So like there's other closed door pharmacies that sell only to other pharmacies or these providers that sell these compounded prescriptions. So you could be doing that. I mean, there's so many things. There's a local insurance company here that hires technicians that helps with, rejections or PAs. I was part of a group with the National Community Pharmacists Association for a diabetes prevention program, and that was ran by pharmacists. You become a lifestyle changed technician, and you start teaching people about diabetes and how to prevent diabetes, and you do these online courses and help them through that. So there's so many different avenues you can take pharmacy technicians other than just, as people will say, pushing pills. There's so much more than you could do with that.
Yeah. A question in the chat. So to work for a retail pharmacy in Houston, Texas, what would be the first step towards that career field?
So, as I mentioned, and Stephen can also chime in here, you have that technician trainee. So you don't have to have usually any experience to become a technician trainee with the Texas State Board of Pharmacy. So if there is a retail location near you, so Walgreens, CVS, HEB, Kroger, whatever is near you, ask if they are looking for any pharmacy technician trainees. Probably the answer is yes. And then register with Texas State Board of Pharmacy. The pharmacy that you work for will give you, a type of code and location to put in because they'll want to know, the Texas State Board of Pharmacy will want to know where you are actually working at. That is documented within your registration. And then from there, you can get practical experience, and then you have 2 years to take your national certification for pharmacy technicians.
Great, thank you. Another question here is the PTCB exam the same as any state board exam that is required to be certified to become a pharmacy technician?
I'll go ahead and answer that one. No, so PTCB certification exam is the national certification exam, and each state has different requirements to work as a pharmacy technician. Some states do have a certification exam, although I think it's only a handful, like one or two maybe now at this point. But state boards of pharmacy will reference the need of a certification exam, and most often they are talking about a national certification like PTCB.
It is nice if, oh, sorry.
ahead.
I was going to just chime in real quick to have that national certification, regardless if your state requires it, because it allows you to operate in multiple states. So I'm licensed in 4 different states right now, and now that I had my PTCB, I can kind of get around certain things that other people that didn't have it would have to go through as far as training programs. So it does help to have that if you think in the future you might be leaving your state if it does not require it.
One person says here, I got my technician trainee registration, but many pharmacies want experience before hiring me. Any advice?
That's a tough one. What I would say is try to figure out if there's some, you're gonna have to go backwards a little bit, right? So I would say see if you can find some pharmacies that are hiring a cashier. You need to get your foot in the door because a lot of people do want experience unless they are actively hiring for a trainee. So try to get in as a cashier, a delivery driver, or hey, can I just come in and help shadow for a little bit? Get your foot in somewhere, let them see how you're working, and then get your experience that way. It's tough to do it beforehand because now you have to prove yourself to an employer that you're worth it. I would just go that route. So if I was in your case, I would say, hey, can I get in as a cashier for now and hopefully become a technician or just get some experience to get to the next step.
That's good, Stephen. I would also like to add, maybe going to community pharmacies, the independent pharmacies. I know we don't have a lot of them out there now, but a lot of them are family owned or privately owned. And so maybe you can get your foot in the door that way by trying some of the smaller pharmacies.
There's one question here. Where can I find education on radiopharmaceutical compounding online?
I'll go ahead and take that one. So radiopharmaceuticals is a little niche side of pharmacy. There's not many facilities that actually practice radiopharmaceuticals. MD Anderson is one of them because we have our own radiopharmaceutical lab, and pharmacy technicians and pharmacists are employed there. However, I'll be honest, I don't know much about it at all. So I would really do your research on radiopharmaceuticals because it's a very niche side of pharmacy. And it's not many places, at least that I'm aware of, that are available and will hire pharmacy technicians, as their first experience. So I'll leave that there and maybe somebody else can chime in.
No other thoughts on that one? Okay. Um, Another question here. I'm currently a pharmacy technician and preparing to write my national exams and also intend to apply for PharmD. Any advice?
Uh, I would say definitely apply. Take your national certification exam for sure. I think that's like a good practice round for what your future exams in pharmacy school will be like. I'll say a lot of the questions that we have, they're patient cases. And so kind of pulling in some of that background, some of that information would be helpful. I'd encourage everyone, if that's your path, if that's what you want to pursue, I would say definitely go for it.
And I'll kind of chime in on Courtney's response. In the hospital environment, we see a lot of pharmacy interns, pharmacy externs, pharmacy students, and a lot of them that do come in with a pharmacy technician certification, and it's still pretty valid because right, they're still in pharmacy school. But because they have that, we can essentially give them a little bit more money, which is always a bonus, right? So they are essentially doing the tasks of a pharmacy technician. So they might be able to do more tasks than, a regular pharmacy student would do or a pharmacy extern. So it's definitely beneficial to have that and have that experience. And then also through pharmacy school, time pending, right? If you can work a couple hours, over the weekend or something like that to really gain that, that firsthand experience, it's really going to help.
I would say, especially if it's an employer that you want to continue to work with after school, most of the time they will hire you if you've been it through there as a technician, an intern, and then potentially a pharmacist. We've hired multiple people that way at our facility. So I think if you can get in there and it's something that you really want to continue, it's only going to be good for you at the end.
Um, Another person here says, I'm currently in school getting my bachelor's in biochemistry. I want to go into toxicology. Would aiming for PharmD be the best path, or are there other options that I should explore? So wondering if you had any thoughts from the pharmacy technician side, and Courtney also from the PharmD side.
I definitely see the connection. In undergrad, I took a toxicology course and I really enjoyed it. And I think I remember mentioning, how much I enjoyed it in like my pharmacy essay, like my admissions essay. I think that your particular background would set you up for success in pharmacy. Our first few courses from the first and second years are like biochemistry based. And so just to kind of set everyone, well, to set everyone up, on a level playing field, just in case if students, didn't take biochemistry in undergrad, we have these courses that are biochemistry based. So I think that would definitely work out in your favor. But I would also say if you have other interests, I would definitely support, exploring those other career paths as well. Maybe R&D, pathways into the pharmaceutical industry. I think that would be another viable option as well.
Is the PTCB certification helpful at all internationally?
So, Tiffany, you might be able to add on to this, but the PTCB certification is primarily in the United States. It's for the United States and the territories of the US. There are some foreign boards of pharmacy that practice pharmacy nearly identical to US territories and states. So the PTCB certification is used there for pharmacy technicians, but it's pretty rare to have an international pharmacy request or even require PTCB certification.
Yeah, and I'll kind of piggyback on that. I actually lived abroad for 6 years. So after getting my PTCB national certification, I chose to live outside the States. And I first went to Belize, which is not that far away, but went there because it was English speaking, and quickly learned that there were not any pharmacy technicians, just pharmacists and cashiers. We didn't choose to stay there. And we went to Costa Rica after that. And it was the same. There's a pharmacist that is always there for you in the pharmacy, and then there's cashiers. So there wasn't really a role as a pharmacy technician within a pharmacy. However, I did work in an allied health in a dental office in Costa Rica, and it was kind of my responsibility, along with, Lexicomp and other drug formulation softwares, to review patients' medications and make sure that they did not interact. And then I was also drawing up intramuscular injections for after surgery. So I wasn't in a pharmacy. However, I was using those pharmacy skills to assist people in their medication route after having dental procedures done.
Speaking of different possible career paths, I know that you three have mentioned a lot already. Um, any other sort of thoughts on different possible career paths? Specifically, are there employers who look for the advanced CPhT specifically?
Yeah, I'll kind of chime in on that one. Um, in all realms, right? There are specific positions that pretty much mimic PTCB's assessment-based certifications. Sterile compounding is a big one, right? To earn your CSPT as a national sterile compounding technician. So in that, you could work as an advanced pharmacy technician, like in my facility, whether it's education, which is the role that I'm in, or you're really overseeing their aseptic technique, right? You're doing media fills, you're doing all the glove, fingertip, and thumb samples, you're doing surface samples. All of that will relate to an advanced career as a pharmacy technician. And that's only one example, right? You have technicians that work on the regulatory side that do compliance. There's a regulatory and compliance exam. You have people who work in billing and reimbursement. There's an exam for that. So all of the kind of pathways that PTCB has put forward as far as assessment-based certifications, they will definitely help you get your foot in the door for an advanced position somewhere else because you've already gone that extra mile. And you've shown that you have not only, a skill set, but then you also have that national certification to back you to go into one of those advanced positions.
I know as an employer, I definitely look into that. So especially in Oklahoma, like I said, it's not required to be even PTCB certified. So when you have that, you definitely stand out amongst all the other applicants. But if you also have an advanced or a specialty certification through them, of course you're going to stand out even more. So I think that it's worth looking into getting those extra certifications because you can stand out more and just show that you're dedicated to the profession versus just somebody off the street that just wants to work in a pharmacy.
Great. Question here in the chat. Are there differences in terms of salary between national certification and or technicians who are nationally certified versus maybe just in their state?
So for the state of Texas, in order for you to become registered as a pharmacy technician, you do have to have a nationally certified pharmacy technician certification. Whether it's through PTCB or NHA, you do have to have one in order to register in the state of Texas. So it is required for you to have it. I will say that a very small percentage of technicians let it lapse. But there's no change in pay due to that. Probably the employer isn't even aware that it occurred, right? And with, annual goals and review and salary increases, it's not something that's usually kept up with. So I wouldn't say that there's any difference whether you have, the national certification or you just register with your state. However, I will say that if you let your PTCB certification lapse and it's not within a certain time where it can be reinstated, you will have to take the national exam again. So it's kind of like a one and done, right? And then just renew it every year with your continuing education credits.
In our state, since Oklahoma isn't required to have the PTCB, we do pay, and most employers here do pay a higher premium for their employees because they are nationally certified. So I think if you were to see a pay bump, it would probably be in those states that it's not required you to be certified through nationally, if you were to see that.
Okay. Speaking a little bit more about, employment and getting hired, what competencies and skills do you look for in a resume for a pharmacy technician, especially one with no prior experience?
So I'll kind of take this first. So unfortunately, I'm not in the hiring phase, but we do have students that come in and rotate. We also have pharmacy externs, interns, things like that. So I'm usually the one that they come to first because I evaluate their sterile compounding skills, or I'm putting them through a 40-hour class for sterile compounding. So through that, like I'm kind of able to see like not only what their skill set is, but also like how is their personality? How is, customer service skills? All those kind of soft skills that are very important in pharmacy. That's kind of what I'm looking out for because they're not yet our employee. They are kind of temporarily within our facility and learning. But if they do come back around, then I can, either provide them with positive or negative feedback when the manager asks, well, how did that person do when they were actually on site as a student or an intern, whatever it might be. So really those soft skills are key, and really being open to learning and experiencing things. And just to go that route, right? When you're here in the facility and you're learning.
I would like to add on to that. Yes, those soft skills are very important. Being detail oriented, we had, in pharmacy, it's important, patient safety is of the utmost importance. And so we have to catch those mistakes before they get to the patient. And so being detail oriented is very helpful, um, would be very helpful to you. Also, I think Tiffany mentioned like customer service skills. So being able to, assist customers or educate or talk to customers as well. Being helpful, friendly, your personality can go a long way as well. Also being adaptable and flexible.
I would just put on there, if you've done any kind of outreach, community service, things like that is always helpful. I love seeing those on resumes. One thing I will say not to do is please don't just chat GBT what a pharmacy technician does and puts that in your job description. I've seen that so many times, and it again, going back to Courtney's paying attention to detail, you're not paying attention to the details because sometimes the wording's not right, it's not spelled correctly. We see right through that, and I honestly don't even look at them because they obviously don't put the time in to fill that out. I've had one person copy and paste Chick-fil-A's whole manual, like the employee manual, like 60 pages of the employee manual into their resume when it came over. I was like, what in the world? So just make sure you look at it at your resume, keep it updated, put as much information as you can that will help you stand out from everybody else. I do like it when there's a little blurb on the very top of it. It kind of tells me your goals of where you're trying to do or where you're trying to go in life. That helps a lot. If you're, first aid, if you have your BLS, if you're, CPR certified, put that in there. If you've done any kind of like shadowing at pharmacies, interns, externs, ships, those things are all always good to put in there. But the main thing on the resume is I would just make sure that it's updated and pay attention to the details of what you put in there.
I'd like to get certified in sterile compounding. Are there any resources you recommend?
So, sterile compounding, at least in the state of Texas, you have to undergo an initial sterile compounding course. For technicians, it's required to undergo a course of 40 hours. Now that is available either, all live or it's available, home study plus live, but it's also going to depend on like what's in your state and what are the rules around sterile compounding, because Texas is very specific to undergo sterile compounding in a workplace. You must have initial sterile certification. I will also recommend for PTCB's CSPT exam, there are some great resources there that can hopefully help you learn a little bit more about sterile compounding. So I definitely look into that. And then also there's great resources online, Amazon, things like that, for sterile compounding basics. There's other methods that I would recommend, but they're more of a paid source and a renewal. So sterile compounding is really based on USP, which is the United States Pharmacopoeia. So sterile compounding is 797. But in order to get their guidelines, you do have to sign up and it's very expensive. So I'd look at the list that PTCB provides and go from there.
Great. One of the pre-submitted questions, someone asked, I'm a newly certified pharmacy technician. Can I get a remote role without retail experience, or should I work in store first?
I would think it would definitely help you working in a pharmacy first before you do a remote role. I know the way that I learn is side by side with somebody and being able to ask questions. I've never worked remote, so I don't know exactly what the communication is with your peers if you need to ask a question. But if it was me, I would say work in the pharmacy first, get your bearings, some of the terminology, and then once you understand that, then you can do your remote work.
Yeah, and I pretty much mimic that saying. We do have remote roles here within my institution. However, you need to have experience as a pharmacy technician, whether it's retail or hospital, before those are available for you because they're more so of an advanced role. I was mentioning earlier about an insurance specialist. So really knowing, kind of the ins and outs of insurance first before you would go into remote roles.
Stephen, you mentioned ChatGPT earlier, so I think this leads well into another question. Will AI affect technicians' jobs?
I think AI will affect technicians' jobs a little bit. I was on a conversation or a call actually a couple weeks ago about bringing in AI into our stores. Um, at the end of the day, there still needs to be somebody there to greet the patient. Still needs to be somebody there that's going to fill the prescription. Where I see AI helping pharmacies is one, helping out with the phone calls because they can answer phone calls and they have really good AI programs that can do that. And two, there's a good AI program right now that will help input and do some, re-adjudication type tasks on the back end. Those are the things that really make a pharmacy technician behind. It's always typing the prescriptions because there's 60 in the queue, there's 100 in the queue. You just can't catch up to go talk to a patient. I think where pharmacy is shifting is technicians doing more immunizations, doing more point of care testing, doing those types of tasks. And in order for that to happen, we have to get them away from typing prescriptions and staying on the phone, all day talking about, the way that, it doesn't matter, but it just, people keep you on the phone for quite some time. So I think AI is going to only give you back your time to be able to do other tasks in the pharmacy and expand the role as a technician.
Yeah, and I completely agree with that. I think we also have to think about, other technologies that also might improve the pharmacy technician and their workflow, right? We have electronic health records, which pretty much stores things for us, barcodes, lot numbers, expiration dates, gravimetric information from compounding. There's workflow software systems that help us organize our patient load, right? They tell us what is the priority, in looking at not only how many medications this patient has from pre-meds to hazardous drugs to pain therapy, but then also like which one should they get first based on the treatment plan. So I think in not only thinking about AI, we also have to think about technology as well. So there's many benefits of technology for pharmacy technicians, and I've only talked about a couple. I mean, in the sterile compounding world, there are robots that compound medications, right? But you still need technicians in order to do maintenance on the robot and make sure it's running correctly. So I think it will shift, but not change. It's definitely going to help us support our roles, but not take over for us.
Great. Next question here. Let's see. How can a certified pharmacy technician advance their career? I know we talked about advanced certifications a little bit, but wondering if there were any other thoughts on this.
I'll kind of take that first. Pharmacy technician careers, if I think I'm not the only one, but they vary, right? We don't have one career path and it sticks with us our whole entire life, right? We get interested in a topic and then we figure out, well, how do I get into that? And what do I need to reach that level, right? My path is all over the place. Retail, long-term care, hospital, coming back to a hospital, right? So if there's something that you're interested in doing, research it, see what you need to do to get to that point. Um, you want to find something that you love in pharmacy, and there's so many different opportunities out there. And each one is going to advance your career because it's going to expand the knowledge that you have about pharmacy technicians and what they can do. So if you're interested in something, definitely search about it, look at the education that's available, and then try it out. Worst case scenario, you don't like it, you revert back to something that you do love.
Yeah, I would just add on to that, diversify your experiences. It will make you a well-rounded candidate for whatever path you choose to go down and you're applying for. You have all of these experiences that you can speak to in the interviews, and it just makes you a well-rounded candidate.
And I'll add to that. Just don't stop learning is the big thing. I think a lot of pharmacy technicians, and you're going to have those people that just want to fill prescriptions and just want to answer the phone, and that's fine. We need those employees, but let your employer know, hey, I want to do more than just count prescriptions. What else can I help you with? Can I help you with the inventory? Can I help you with X, Y, and Z? And that initiative alone will hopefully help you get to the next step in your career. That's the way I did it. So my pharmacy manager at Sam's Club, I was his right hand. He gave me every, task that he didn't want to do or didn't have time to do. And then that's how I learned a lot of the stuff that I have to be able to, advance my career. So don't stop learning. Be very curious in every little task, even if it's stuff that you probably shouldn't know or don't need to know. If you're interested in it, why not? You can't counsel a patient on something, but you should kind of know a little bit about it so you can give the pharmacist a heads up. Hey, this came over. What should I do? Or maybe you missed this. We've had quite a few technicians that sometimes catch things that the pharmacist just was busy that time, and it's just a small little thing, but I'm glad that we have those types of technicians that pay attention to those details. So just keep learning, ask good questions, and just continue to talk to your manager about other paths that you can potentially get into.
I would
I'm
just
going to
add
add
one more
on.
thing.
Yep, go ahead. No, you start and then I'll go.
I was going to say that if you can find someone who's doing what you want to do, see if you can shadow them. Just shadow them for a day or a week, whatever works for you. But also finding a mentor that will really help you throughout your career as well. So I would say LinkedIn, utilize LinkedIn, and that just expands your network to plenty of professionals out there that you can reach out to and just send them a message like, hi, I'm really interested in such and such, and I see that you're experienced in this area. Do you have, 10 minutes or so to kind of share your experience and your journey on your career path? I've done that numerous of times, and people are really um, people like to talk about themselves essentially, but people are willing to help you as well. So I think that's a good start.
Courtney, you took the words right out of my mouth. I was going to say find a good mentor. There's also a special bond between pharmacists and technicians. So when you get into pharmacy, you'll realize that bond exists. Somebody, early in your career, there'll be somebody to look up to, somebody to ask questions, and somebody that's really going to help you make, life goals and decisions, right? And they'll stay with you throughout your career. Even if you move somewhere else, it's somebody you can always go back to and say, hey, I did this and I wanted to get your feedback on it. And the pharmacy world is very small and we're very interconnected. So if, your pharmacist or your advanced pharmacy technician or whoever you're working with, it's probably not the last time that you're going to have a connection with them. And you'll build connections throughout your pharmacy career, especially if you're going to conferences and doing continuing education events. It will definitely come up, and there's definitely less than 7 degrees of separation. There's like three, probably. So always ask for assistance, always ask for support, whether you know the person or not. Because yes, we do like to talk about ourselves in pharmacy.
Yeah, and I do want to add to that, Tiffany. You brought up a great point about going to conferences and continuing education events. Um, you might not find a mentor or somebody at your employer, at your place of employment, but every state has their pharmacy association. There are, if you're a pharmacy student, there are student associations on the national and state level. So you can always, if you don't feel supported in the workplace, but you need the paycheck, you can always look outside of your employer to those pharmacy associations for that kind of mentorship and guidance. You never know who you're going to meet.
Awesome. And let's see, we've got 5 minutes left. I think we have time for a few more questions. So if you do have any last minute questions, please put them in the chat now. Until then, I think I have one more pre-submitted question I will ask. Knowing what you know now, what would you have done differently to better prepare yourself to climb the technician career ladder?
I'll go ahead and take that one first. So pharmacy was something that I got into because I went to a vocational school that was intended to be nursing was the final goal. But I got into a co-op job that was working at a Rite Aid pharmacy because I had good typewriting skills at that time. I know I'm aging myself. But there was those skills that got kind of my foot in the door for pharmacy. Now I still had, a goal of becoming a nurse practitioner of pediatrics. That was my goal. I lasted until rotations in nursing school and then realized it wasn't for me, right? So we had that discussion already earlier about, knowing if this role is good or bad for you, right? Does it fit in with what you want to do for life? And at that point in time, I said, I said, I'm going back to pharmacy. And then from there, working in my first hospital job, really loving compounding. And then going from there, that definitely helped make my job into a career, which is very important, right? You have those skills and you want to build on them. So from there, you just look at, okay, how do I get a national certification? How do I get, advanced certification? How can I really push myself to really work at the top of my licensure as a pharmacy technician? And that's kind of the mindset that I had, realizing that my career goals when I was in high school were not the ones that actually was achieving.
I would say I probably wouldn't change too much. I've kind of bounced around as a pharmacy technician. I've used my skill sets as a technician in different areas. So I would just, again, support diversifying your experiences. If you have an interest in a certain area, try it out. Pretty much try anything essentially. And then I guess I wish I would have started pharmacy school sooner. But honestly, I think everything just works out for you in the end. And so, hindsight's 2020. But I also think that the varied experiences that I have that's made me become the person that I am today. And I have all of these experiences that I can talk about. And I think it really sets me apart from some of my classmates or other counterparts that may have not limited experience, but more just kind of straightforward in one particular area. So I would say get out there and try new things, get uncomfortable, and just do your best.
Yeah, I agree with Courtney and Tiffany. I don't think I would change much of what I've done. I think what if I were to change anything, I wish I would be able to see the hospital side of pharmacy. I just wanted to go into that, and I got cold feet and kind of backed out. And I'm thankful I did because that's when I opened up our own pharmacy. So it was a good thing that I did that. But I would love to go in there. Maybe Tiffany will invite me one day to go see the lab. Uh, but I wish I would get a little bit more hospital sterile compounding experience.
Awesome. And I think this is actually a good point to end it on. So, a couple of things before everyone heads out. First of all, thank you so much to all of our panelists and to Zach for sharing the time with us today and sharing your experiences and your advice. I certainly learned a lot, and I hope everyone else here did as well. We will be posting this recording on the Farm from a YouTube afterwards. It'll probably be up by tomorrow. I'll send a quick follow-up email to all of you registrants and attendees so that you have the link to the recording for today. I'm also sharing two links in the chat now. One, if you want to learn just generally more about PTCB and becoming a pharmacy technician, I put the ptcp.org website in the chat. If you want to learn just more about pharmacy as a whole, please visit our website, pharmacyforme.org. And then, of course, if you have any questions for us, you can always reach out to us via the Contact Us page or by emailing us at pharmforme@aacp.org. But with that, thank you all so much for coming, and I hope everyone has a great evening.
Take care.